Now that we have done the surgery for the cherry eye, let's talk about what can happen after. Let's talk about the post-operative care, what the client should do after the surgery, and let's talk about some of the possible complications. So for the job of the owner, let's say of the dog, we will have 1 to 2 weeks of topical eye drops. Nothing very difficult to do, but it is important to put this topical drugs. Sometimes we will add oral medication depending again on the case. Another thing that is important to keep in mind is that this dog or any dog after this kind of surgery will need to wear an e-collar to prevent the dog from scratching. There are some sutures inside. They are very small, but sometimes the dog after this irritation, after the surgery, will try to scratch, and the more he scratches, the more he creates an inflammation, and the inflammation will invite more scratching, and it's a circle that we want to avoid. It is important to note for the owner, when you take back the dog from just after the surgery, you will notice that the membranes are red, almost as if the surgery was not done, because we still see this, let's say, little redness on the nasal corner. It's normal. We just worked on this eyelid. It is normal to have an inflammation, and this inflammation will disappear with time. 10 days, 2 weeks post-surgery, the eyes are absolutely normal and the gland is in its normal position. Let's talk about some of the possible complications of this surgery. We can have, as I said, a recurrence of the prolapse, rare but can occur. We can have an infection, as in any surgery. We can have some corneal irritation, although extremely rare. It can happen. We can have some reaction to the suture material, and we can have some cyst formation. All these complications are extremely rare. We almost never see them, but it is important to know them. It's something that we explain to the clients every time they want to operate their animal for the cherry eye, but we rarely see any complication for this surgery. It is one of the surgeries that present very few complications.